Hello friends, I'm back with my next video on pharmacology. Let's learn pharmacology. So friends, today we'll be discussing on pharmacokinetics. Pharmacokinetics. What is pharmacokinetics? It is simply a body response or what the body does to the drug once it is administered in the body. We will be learning in pharmacokinetics. Pharmacokinetics involves four main processes, that is absorption, distribution, metabolism, excretion, ADME. Remember it as ADME, absorption, distribution, metabolism and excretion. So once the drug is administered in the body, it goes to the bloodstream. Then from the bloodstream, the drug goes to the cell, that is inside or outside the cell. From the cell, it goes to the liver where it gets metabolized, then it gets eliminated. So the movement of drug from the site of administration into the bloodstream, that process is known as absorption. Then the movement of drug from the bloodstream to the cell or the tissues is known as distribution. Then the movement of drug from the cell or the tissues to the liver, that process is referred to as metabolism. From the liver, the drugs or its metabolites gets eliminated. That is known as elimination. This is the final step. So coming to absorption. First, absorption. What is absorption? It is the movement of drug from the site of administration to the bloodstream. That is known as absorption. Absorption happens through four different processes. That is passive diffusion, facilitated diffusion, active transport and endocytosis. First, coming to passive diffusion. What is passive diffusion? Most of the drugs get absorbed by passive diffusion. In passive diffusion, drugs moves from higher concentration to lower concentration. Here the drug moves from higher concentration to lower concentration until the equilibrium is attained. And passive diffusion does not require any energy. Most of the lipid soluble drugs undergoes passive diffusion. Point to be remembered in passive diffusion is the drug moves from higher concentration to lower concentration. Then coming to facilitated diffusion. Usually the large molecules undergoes facilitated diffusion. It is facilitated diffusion is same like that of passive diffusion, but here they need a carrier for transportation. Like they too move from higher concentration to a lower concentration, but they need a carrier as a transport. Next, it does not require any energy like that of passive diffusion. Coming to active transport. Active transport is opposite to that of passive diffusion. Active transport, here the drug moves from lower concentration to higher concentration. Opposite to that of passive diffusion. Remember it as lower concentration to higher concentration. Like active transport, here drug molecules move from a region of lower concentration to higher against the concentration gradient. It is opposite to that of passive diffusion. Next, coming to endocytosis. Here the drugs of very large size, they get transported through endocytosis. Thus they get infit in a carrier body. Next, coming to factors influencing the drug absorption. The factors which is influencing the drug absorption. First, coming to physicochemical properties. In physicochemical properties, we have physical state. Physical state, liquid forms of the drug get better absorbed than the solid forms. Lipid soluble drugs get better absorbed than the solid forms. So, the lipid soluble drugs gets better absorbed than the water soluble drugs. Particle size. Smaller particle size get better absorbed than larger particle size. Disintegration time. What is disintegration time? It is the time taken for the formulation, that is the tablets, to break into smaller particles, that is called as disintegration time. Next, coming to dissolution time. What is dissolution time? Here the time taken for the particle to go into the solution. That is called as dissolution time. Shorter the dissolution time, better will be the absorption. So this all affects the drug absorption. Next is route of administration. Some drugs like highly polar compounds does not get absorbed through GIT. Hence they are given parenterally. Example we have is insulin, gentamicin. Insulin is given parenterally because they get degraded in GIT upon oral administration. So it is given parenterally. Most common example for route of administration that is affecting the drug absorption when given through oral administration. Next, coming to pH. Strongly acidic and strongly basic drugs usually remain in ionized form at all pH. Hence, they get poorly absorbed. Strongly acidic and strongly basic drugs, they remain in ionized form at all pH. Next, coming to food. Food also affects the drug absorption. Often, patients are instructed to take the medicines with food or to be taken on an empty stomach. Like we have example tetracyclines. Tetracycline absorption gets slower when taken with milk or milk products. Next is propranolol. Propranolol when taken after food, its bioavailability get increased. So it also affects drug absorption. Next is presence of other drugs. Sometimes administration of one or more drug at a time affects the absorption property of one another. Like example we have antacids. Antacids reduces the absorption of tetracyclines. Next, coming to bioavailability. What is bioavailability? It is simply a fraction of drug that reaches the systemic circulation from a given dose. Means amount of drug that reaches the systemic circulation from the administered dose. That is called as bioavailability. I repeat here, amount of drug that reaches the systemic circulation from the administered dose, it is called as bioavailability. It is very important, please listen to it very carefully, that fraction of drug that reaches the systemic circulation from an administered dose is termed as bioavailability. IV route shows 100% bioavailability because the drug given through IV route, it enters the blood systemic circulation directly and bypasses the first pass metabolism. Hence, it shows 100% bioavailability. Next, bioavailability is very important for oral route. If two formulations of the same drug produces the equal bioavailability, like if two different formulations of the same drug produces the equal bioavailability, it is termed as bioequivalent. Bioequivalent. When a graph is plotted of plasma drug concentration versus time, from this we can calculate the bioavailability. When the drug is given, we are comparing the drug through two different routes, like when the drug is given through IV route and when the drug is given through oral route. When the drug is given through the IV route, bioavailability is 100% because it enters the systemic circulation, so it shows a very straight line. Whereas when the drug is given through the oral route, it shows some very different curve, because when the drug is given through the oral route, the part of it will get absorbed and some of it will get eliminated before it reaches the systemic circulation. So both looks different. And from this we can see the area under the curve, that is area covering the curves. Area covering the curve through IV route, area covering the curve through oral route. From this AUC, that is area under the curve, we can find out the bioavailability of the drug. That is area under the curve through oral route by area under the curve through IV route over time 100. So bioavailability can be calculated as AUC oral by AUC IV over times 100. Hope you people get clear idea about the bioavailability. Now factors affecting the bioavailability. What are the factors that is affecting the bioavailability? Factors which affects the drug absorption also affects the bioavailability of the drug. Other factors that includes are first pass metabolism, hepatic diseases, enterohepatic cycling. Factors will be recalling you what are the factors which is affecting the drug absorption. First we have physicochemical properties, routes of administration, presence of food, then administration of one or more drug, that all affects the drug absorption. Now other factors, first is first pass metabolism. What is first pass metabolism? It is when the drug are administered orally, they have to pass through the gut wall via the portal vein, then it enters into the liver, then it enters in from the liver, it enters into the systemic circulation. During this entire passage, certain drugs get metabolized and are removed or inactivated before they reach the systemic circulation. That process is known as first pass metabolism. When the drugs get administered, they have to pass through the gut wall to the liver, then from the liver it enters into the systemic circulation. During this entire process, the drugs gets metabolized or are removed or get inactivated before they reach to the systemic circulation. After this first pass metabolism, the net result we'll get is the drug with a decreased bioavailability and diminished therapeutic response. Example for the first pass metabolism is lignocaine. Lignocaine is administered through IV route in ventricular arrhythmias due to extensive first pass metabolism. Lignocaine is administered through IV route because of extensive first pass metabolism. Next is the hepatic diseases. Hepatic diseases, it results in decrease in drug metabolism, thus increasing the bioavailability of drug that undergoes first pass metabolism. Example for this is propranolol. Enterohepatic cycling increases the bioavailability of the drugs. Example for the enterohepatic cycling is morphine. What is distribution? It is the movement of drug from the bloodstream to the cell, that is it may be inside or outside the cell. That process is known as distribution. Once the drug get absorbed, it get distributed from the systemic circulation to the cell membranes or the tissues. Distribution depends on 4 factors, that is lipophilicity, blood flow, capillary permeability, plasma and tissue binding. First coming to lipophilicity. Lipophilicity, high lipophilic drugs passes much easier than the hydrophilic drugs. Blood flow. Some organs such as brain receives more blood flow than the skin. So if a drug passes through the blood-brain barrier, then it gets accumulated much easier or faster in the brain than in the skin. So it is higher in the brain than in the skin. Next is capillary permeability. Capillaries in the liver have such junctions through which larger bodies can pass. On the other hand, in the brain, they don't have such junctions that make difficulty for the drug to pass through the brain. So it is more in the liver than in the brain. Next coming to the plasma and tissue binding. Many drugs, they binds to the albumin, which is a major drug binding protein site. Albumin, that significantly slows the distribution process. It significantly slows the distribution process. Distribution can be calculated as VD is equals to volume of distribution is equals to total amount of the drug in the body by concentration of the drug in plasma. I repeat here, VD is equals to total amount of the drug in the body by concentration of drug in plasma. If concentration of drug in plasma is high, then volume of distribution is less. Like if VD, volume of distribution, is more, then more amount of the drug should be administered to achieve the desired drug concentration. Hope you people got the clear idea about absorption and distribution. Hope you people understood absorption and distribution very clearly today. So today we learned about absorption and distribution under pharmacokinetics. Now we have metabolism and elimination is left. In next video we'll be discussing on metabolism and elimination. Thank you for watching my video. Please don't forget to like, share and subscribe to my channel. Thank you.